Let me be honest with you. Kenntnisprüfung is not difficult, but it can actually destroy your career. It's not because doctors are stupid or because they don't study. It's mainly because nobody explains it properly, especially doctors coming from foreign countries and who are like new to the system. You might have heard of all the rumors and all the horror stories, and you hear all this advice from all these people who have never passed Kenntnisprüfung themselves. Yet it's true, Kenntnisprüfung has a notorious passing rate. It's around like 65%. In this video, I'll explain to you what Kenntnisprüfung actually tests, why many international doctors fail, and how you should approach Kenntnisprüfung strategically and not emotionally. Kenntnisprüfung has only one purpose, and Germany only wants to know just this one thing from you. Can you act and think like a German doctor? It's not about trick questions, it's not about those rare syndromes, it's not about memorizing Harrison or Bailey. This exam tests just three basic things: clinical reasoning, guidelines-based decisions, and the most important of all, patient safety. The examiners don't actually check how much you know. What they actually test is, can you think and perform properly under pressure. The usual format of the Kenntnisprüfung is it's case-based, practical, and it ends with a discussion with the commission. You're given a patient scenario, and then you have to do the basic history, the clinical examination, and then they listen to how you approach the case, how you structure your answer, whether your steps are safe and logical. And usually those long and complicated answers, they don't impress them. But what impresses them is clear, structured, and rational thinking. If you face the exam or the examiner as a German assistant doctor, in the back of your mind, you pass the exam. And if you speak like a typical entrance exam candidates with those multiple choice questions on your head, you usually fail. And here's the uncomfortable truth. Most international doctors or doctors from India prepare for the Kenntnisprüfung in the wrong way. They prepare and treat this exam as if it's some multiple choice exam like NEET PG or any other entrance exam. And this mindset is going to destroy you for sure. Because examiners are not looking for the right answer. The answer they are looking for is, why are you doing this? When should you do this? Because guidelines matter, indications matter, contraindication matters, and documentation matters. And Kenntnisprüfung is actually a decision-making test and not a memory test. And after working with more than 100 Kenntnisprüfung candidates who have done our Kenntnisprüfung preparation test, the ones who fail, these failures come always making the same mistakes. Unstructured answers, ignoring German guidelines, unsafe management steps, panic, or either overconfidence. So let me be clear with one thing. The examiners are not there, not your enemies, and they are not there to trap you. They are there to protect patients. And if your approach is safe, logical, and guideline based, you usually pass the exam even if your German is not that perfect. A real and serious preparation for Kenntnisprüfung looks like this. First is a system-based learning: internal medicine, surgery, emergency medicine, radiology, pharmacology. Actually basing your learning on case discussions and not just to textbooks, and reading up the German guidelines and not all those textbook or Rambos or whatever you are preparing. And the most important of all is the speaking practice. You have to speak out and loud in German. This means studying alone with books is never enough. You must train yourself to think clearly, speak clearly, and defend your decisions calmly, and that is what this exam actually tests. At Medbridge, we don't help the doctors just prepare for the exam. We prepare them to work safely in Germany. This is why our Kenntnisprüfung preparation is clinical, not academic, structured but not random, guideline-based and not opinion-based. Now, doctor pathway for international doctors is a recognized pathway by the District Council of Munster, and it allows you to stay legally in Germany with the 18D visa for up to 24 months. We actually help you integrate into the system. No guessing, no shortcuts, and no false promises. And our goal is confidence through competence. In my next video, I'll talk about the timelines, and not like those Instagram timelines or just agent promises, real timelines based on real hands-on experience. I'll explain to you how long this Germany process actually takes, where doctors lose months or years, and how to plan this journey without burning your career. So subscribe to our channel if you want clarity and not confusion.